My guest today is Dr. Christian J Vercler, who is a plastic surgeon and an ethicist. He's a faculty member in the section of plastic surgery in the Department of Surgery with a joint appointment in the Department of Neurosurgery at Michigan Medicine. He serves as the co-chief of the Clinical Ethics Service of the Center for Bioethics and Social Sciences in Medicine at the University of Michigan, and he has a special interest in medical ethics. So Dr. Vercler currently serves as the chair of Pediatric Ethics Committee of CS Mott Children's Hospital and is co-chair of the Adult Ethics Committee at Michigan Medicine, among multiple other appointments. So, Dr. Vercler, if I'm right, then part of your role is to be ready to go to the bedside of a patient to help a doctor deal with a complex ethical case. So I want to know, when you do that and you're trying to resolve an ethical dilemma, are you actively bringing to mind normative ethical theories?
Yeah, I am. One of the first things that I do when we do that is when someone calls and they launch into a long story, I engage in a bit of a dialogue to sort of say, what is exactly the ethical question that you need me to try to answer? And and then if we can formulate the question, then it helps us sort of apply specific theories to the case at hand.
I've heard in past interviews you've talked about a plurality of ethical theories. So I've heard you bring up virtue ethics and the importance of developing phronesis, practical wisdom, about the second formulation of Kant's categorical imperative, the means end formula, and also the sort of four principles of medical ethics, which I guess you could think of as deontological principles broadly. Right. Does that mean that you're a pluralist when you approach these questions?
As an ethicist, yes. I often say, as a practicing surgeon, I don't have many ethical dilemmas that I encounter because I'm trying to exercise my phronesis as a virtuous surgeon and, develop the right path that in a relationship with my patients. But when I'm called in as a consultant, I do use a plurality of approaches, primarily because we live in a pluralistic society, and the reasons that I have as my unique characteristics in education and upbringing, I have a way that I solve ethical dilemmas, or that I avoid ethical dilemmas in the way that I live my life. But when I'm called in to consult, my own personal views may not be convincing to or broadly acceptable to the many parties who are engaged in an ethical dilemma. So I find myself drawing on many different philosophical traditions. So you could say, in a pluralistic way, I'm trying to offer reasons that can be found acceptable in the public square. And so I draw from many different, philosophers or traditions in that way.
That's so interesting. Okay. This question is more specific to do with our background, like what we do at TKEthcis specifically. So we're interested in the effect of the development of technology generally. So obviously surgical technology is one thing, right, but we're also interested in artificial intelligence and its proliferation. Have you seen that affect the field of plastic surgery so far? And do you have a prediction about what that's going to look like in the next decade?
Oh, hard to know. I'm sure it's going to be everywhere. I wrote a manuscript that I don't think it's not been accepted anywhere yet. Talking about AI's effect, specifically generative AI in regards to the generation of images, using kind of the critiques of Byung-Chul Han and this idea of hypertransparency and how that can sort of degrade moral choice and things like that in regards to patients. And so I guess in plain English, how it can also just generative AI, some plastic surgeons will use it to try to predict postoperative results, or patients might use images of themselves to try to imagine a future state where they're more perfect in some way. And I think those can be unrealistic potentially. So again, there's a lot with images and how we engage with those and how that it sort of trains the mind to see and think of the world in a certain way. And that's definitely impacted plastic surgery significantly in, say, the past 5 years. And so I imagine that it will continue to be the case. Luckily, what I do in terms of, as a surgeon performing operations, I don't see AI changing that in plastic surgery anytime soon. There's some interesting stuff with general surgery and laparoscopic surgeons, when they do things, and a lot of that is they're looking at a screen, so they're already looking at a mediated image, which can then also be subjected to AI analysis. And there's some very interesting things about identifying structures, let's say in a cholecystectomy, that an AI model may be better or safer in its judgment of identifying things than a novice surgeon. So I think that there are going to be definitely AI impacting the field of surgery. It's not coming for the plastic surgeons quite yet. I think I still have a little bit of.
In terms of responsibility for a doctor using an interface, like right now, it seems like they still more or less have control over all the equipment. But if we start integrating AI and it starts assisting surgeries and then a mistake is made, do you have a sense of how blame would be apportioned or how the liability would work there?
Well, that's an interesting question, and I think it's one that I actually was on a panel a year or two ago discussing this at the ASBH. Yeah, that's an interesting question. Surgeons, I think today especially surgeons with gray hair, have been trained to take full responsibility for everything that happens in the operating room. There are some people who find problems with that. I still think that in terms of that the training of surgeons is the training of people to take responsibilities for their actions, specifically as it relates the other person's outcome and you surgeon. And so if you're the surgeon and you're employing AI and a patient gets harmed, I think that the way I view surgical responsibility, that surgeon still is responsible for that. Now, again, there are some that find that the presence of a human who, and we're all fallible, could be improved if you remove that human element from the equation and replace it with an algorithm. So that it may be the case that we're going away from that. Some find that the pointing to the responsibility of the individual human problematic in terms of rooting out error in the system, right? So if you say no, it's a systems problem, not a human problem, then you might find that AI, if you have that point of view, AI could be considered quite helpful in eliminating errors and could potentially reduce harms. Again, one perspective. I'm still old-fashioned and think that the surgeon is responsibility for what happens to the patient. I think that patients looking you in the eyes before they get drifted off to sleep want to trust their surgeon and not just trust the system. I think the interpersonal relationship and communication is still essential.
Absolutely. But I guess if it was really demonstrated to me that there was a 10% safer opportunity with an AI, I would give up the chance to blame someone for my death. Great. Maybe we should move on to the second part. Sure. So we have this specific ethical case. So we do this competition. You know the Ethics Bowl, which is great. There's an English version called the Ethics Cup as well, and now another sort of worldwide version called the Ethics Olympiad. And this is high schoolers, middle schoolers discussing complex ethical cases. One of them is Rhinoplasty and Ethnic Heritage. So I thought it might be good if I just quickly read through the case. I'll have it up on the screen as well. And then we could discuss the ins and outs from, I think, the doctor's perspective and then also from potentially the patient's perspective too.
Yeah.
Okay. So here's the case. Chiara is a 28-year-old Italian woman who moved to the United Kingdom for work. From a young age, Chiara was teased about her prominent Italian nose. She'd been called various names like beaky, hooked, and witchy by her classmates. This treatment and reaction to her nose led her to develop a severe insecurity about the feature through her teenage years into adult life. On the other hand, her family celebrates this feature as a mark of beauty and heritage, as it is common not only in the family, but a lot of Italians. Despite this, Chiara has always had negative associations of shame and ridicule with her nose. She's recently booked a rhinoplasty consultation in the hope that the procedure will bring a sense of relief from her insecurity and a renewed sense of confidence. However, As the appointment approaches, Kiara begins to feel morally conflicted. The surgery itself is relatively minor, but it will be permanently altering a physical feature that connects her to her family and her Italian identity. Kiara worries that seeking a more conventionally attractive nose amounts to conforming to the Anglo-American beauty standards and rejecting her heritage. This seems to be constantly amplified by social media and the normalcy of undergoing surgical procedures. She wonders whether she would still be herself after the surgery and has doubts about whether it will renew her confidence as she hopes it will. It can be argued that Kiara is right to feel conflicted. On this view, changing her nose is not merely a cosmetic alteration, but a rejection of her ancestry. To undergo a serious surgical procedure just to conform to societal beauty standards suggests that Kiara has internalized the prejudice she's experienced and that she sees her Italian features as something to be fixed. Furthermore, some would claim that Kiara has a duty to resist the beauty norms to which she feels pressure to conform, not only for herself, but for her family and for others who share her heritage. However, others may argue that Kiara has no such duty. Instead, she should do what's best for her well-being. If the teasing has given her problems with her body image and confidence, then cosmetic surgery may be the only form of self-care left. On this view, Kiara is not rejecting her culture, but exercising autonomy over her body. Some people wear makeup or style their hair to boost their confidence, and surgery is simply another way to alter one's appearance. So, the first question I have for you about this, and I'm happy for you to take this in any direction that you see fit, but my first question is that I saw you say in an interview at one point, very briefly, that the fathers of rhinoplasty in New York City aim to make ethnic noses look more typically Irish or Caucasian. So can you, I sort of tried to look that up a little bit. Can you tell me any more about that historical component?
Yeah, there's two books I can refer you to. One is called Making the Body Beautiful by Sandra Gilman, who's a sociologist, and he's written lots of books about normalizing Jewish bodies. So he has a history of medicine, but also of Jewish heritage. And so again, a prolific author. But Making the Body Beautiful by Sandra Gilman talks about this. This book, I pulled it off my shelf, so I'd have it ready. Surgical Sculptor by Paul Natvig. Paul Natvig's a plastic surgeon who trained at the University of Michigan, but he wrote this history on Jacques Joseph, who's considered sort of the father of rhinoplasty. And Jacques Joseph was born Jacob Joseph and changed his name because he was Jewish, changed his name to Jacques because that's much more cosmopolitan sounding if you lived in Berlin in the early 20th century. And he trained him, all the people who became leaders in rhinoplasty surgery and in plastic surgery, but two in particular who moved to New York were Gustav Aufrecht and Jacques Meliniak. Aufrecht and Meliniak are considered fathers of plastic surgery and started the American Society of Plastic Surgeons. But both of those men had their practices in New York City. Both of them were Jewish. One was Polish, one was, I believe, Hungarian. So it's interesting how the history of rhinoplasty is intertwined with people with certain ethnicities trying to pass in a cosmopolitan environment. So yeah, from the very beginning, this practice of rhinoplasty is entwined with the dilemma that Kiara is wrestling with.
Okay, that's awesome. So, well, I say awesome, it's interesting. So I guess starting from the doctor's perspective, this is a side that I would have no idea about. So someone comes to you, maybe it's not even your specific practice. It sounds like you might do more pediatric stuff, but if you were... I'm
a craniofacial surgeon, so this is all in my bailiwick. I do rhinoplasties. I don't primarily do cosmetic rhinoplasties, but I have had this exact situation come up. So yeah, I do these.
Wow. A small interim question for my own understanding. What is the difference between cosmetic and is it functional? Is that the other side? Like, is there a clear line or is that sort of a confusing area as well?
Yeah. So I have some slides on this and talks that I give on this kind of thing. If you think now, again, I love, no one's ever pushed back on me with this classification schema that I have. But if you imagine human appearance on a Gaussian distribution, on a bell-shaped curve, okay? You've got this bell-shaped curve. The center part is like 50th percentile, and then you've got several standard deviations in either direction. So I define cosmetic surgery as taking someone under the large area under the curve and moving them towards maybe 1 or 2 standard deviations above the mean in terms of being attractive or beautiful. And I think that generally speaking, reconstructive surgery is taking people who are 1 or 2 standard deviations below the mean and moving them back towards the mean. So the history of plastic surgery involves an intertwining of these things. If you look at all of these, how did Jacques Joseph become a master at taking humps off of ethnic noses? Well, because he was reconstructing noses that were shot off in World War I during trench warfare. And so reconstructive surgery, another statement that a little adage is, aphorism, all good reconstructive surgery eventually becomes cosmetic, meaning someone comes to you and they're missing a huge portion of their face from a gunshot wound, and you start to rebuild their face. There are always little things that it looks like a passable nose, but could look like a better nose. Well, maybe one more operation, and yes, we could make it look a little bit better. And so that's certainly the case with breast reconstruction and many of these things, that all good reconstructive surgery eventually becomes cosmetic. But the idea that what you asked specifically was difference between cosmetic and functional, I think is a great question when it comes to features of the face. Because what is the function of the face? It's the center of human communication, right? And so anything that is impacting your ability to confidently communicate could be seen in changing that. You potentially could improve the person's ability to communicate. And so I do operations that affect children's speech. So children born with cleft palate, you fix the cleft palate so that kids can have functional speech. And so because we can't speak if all of the air is rushing out of my nose, but if you have a hole in the roof of your mouth, the air doesn't get directed appropriately. And so there are some operations that we can do to close the palate in infancy, but those are operations that we do later in life that can improve the speech if the quality is a little bit nasally. And we'll do that operation if we feel that it's going to affect the child's ability to effectively communicate. Sometimes I think that if you have a significant deformity of your face or something, so again, the question is, what do you mean deformity? But if many times I'll have a child who has a cleft lip, and when you have a cleft lip, you have a large hole through the nose and through the mouth, down through the lip. And when you repair that in infancy, as kids grow, their face changes, and I might look at a child and they still might have the stigmata of a repaired cleft lip. In my mind, I think to myself, I know what a perfect lip should look like. But if a child is not impacted in their ability to confidently communicate with others, and it's not affecting their self-perception, then I don't suggest doing anything to that child. But if someone also, on the other side, if someone says, don't you see what's wrong with my nose, Dr. Vercler? And I go, I don't really see anything wrong with your nose. And they may, and if they think that but in their mind, they might think, oh yes, but this little aspect of my nose right here is what's going to make all the difference in the world to me if you change it. I worry a little bit about someone who's hanging so much importance on a very small anatomical difference that they see, or it may not even be a true difference, but just an anatomical feature that they're fixated upon. There is something called body dysmorphic disorder where people really perseverate on certain things. I'm not suggesting that Chiara has that, but that is something that the psychiatrists and plastic surgeons diagnose, and we try not to operate on people who sort of have an overinflated sense of the importance of a small anatomical feature that they have.
Mm. So if Chiara comes to you and says, I've got this lifelong of baggage, I know that it's psychological, I know that there's like nothing really wrong with me, but I'm having this experience every day. I see myself in the mirror and that's all I can, I'm fixating on it.
Yeah.
What do you say to her? Do you try to talk her down, or do you refer to a psychiatrist potentially? Is that ever part of the practice?
Yeah, if it was a real fixation, if they're thinking about it, and I'm sorry, I don't know if this off the top of my head, I should have looked it up, but there's sort of, if it's like preventing you from leaving the house, if it's sort of your can't dinner dates with your friends because you feel like you can't go outside because you're so concerned about your appearance or the one body part. If you're checking it once or twice an hour in the mirror, and it's disrupting your ability to perform your job or your schooling or whatever, then usually those are some of the things that we'd say like, okay, this is a major psychiatric problem that requires psychiatric intervention or something like that, not necessarily surgical intervention. Then there's this gray area where someone says like, well, I'm on Zoom calls at least twice a day, and I just feel horrible about it. I hate myself in photos. Um, all sorts of things like that. Well, then usually the criteria that I use to do a cosmetic rhinoplasty is to sort of say, you know, um, do I also appreciate what the patient is pointing out? Because sometimes people fixate on aspects of their nose that I can't really appreciate what they're talking about. I also think, can I make a change in what they're identifying? And can I do it safely and reliably and can I accomplish the result that they actually want? Because sometimes, so then you might say, like, we have a saying that the best way to have a happy post-operative patient is to have a happy pre-operative patient. So if someone is literally just, so miserable and depressed, and you detect that they're, suffering significant depression, they're not leaving the house and so on and so forth, an operation is not going to fix that. But if they're sort of otherwise, getting through the day and they're fairly fine and they have one little thing but they just sort of say, I really wish that you could change this one thing about me. I feel like I'd be much more confident. I've always hated my nose. And it's a structure that you can, again, reliably change. Then and the patient seems to have reasonable expectations. Like if they say things like, or you through discussion, get them to the point where they say, I realize this might not change. The man of my dreams is not going to suddenly appear, or I will not get a raise at work, or you know what I mean. Sometimes people will have these like delusions of grandeur of what their life is going to be like post-operatively.
Yeah.
They sort of say, I know this isn't going to change anything about how I function really, but it would make me feel so much better, and I feel like I would have so much more self-confidence doing that. And there's plenty of patients who are incredibly happy with their appearance and really grateful and ecstatic about how they look after a cosmetic rhinoplasty. And so, if in the right patient, I think a cosmetic rhinoplasty is beneficial to the patient, and I would proceed.
Okay, super interesting. So now I think let's look at it from Chiara's perspective and this sort of cultural perspective, which I understand is probably not what you would do as a clinician in this case, but now thinking just more broadly ethically, do you think there's anything to be said for this idea that you have an obligation to your culture to protect something about you that reflects cultural importance?
It's really interesting. I remember having this conversation with an older Jewish plastic surgeon in Boston where I trained. And I remember he said and looked at me with a grin and a wink, sort of saying, I'm going to put bumps on noses. He said, I want to go around and give people a bump on their nose. And that was sort of his, and I loved that, and just sort of saying like, we get to a point, especially like in Boston, right, where the idea of the Boston Brahmin and a certain waspy appearance is culturally dominant, at least historically. Yeah, you could see where in that environment you might really want to fight back. Whether or not someone has a duty to appear their ethnicity, I don't know how to answer that question. I don't think that I'd say it's misplaced, especially given ever since the 19th and 20th century is sort of marked by this hyper individualistic sense of self, where we're sort of told in our modern culture to unmoor ourselves from any markers of identity that are anything less than we choose for
Mm.
ourselves. That seems that you can be whoever you want to be in our neoliberal capitalist society, right? That you should be, and you should not take an identity as given, but should actually seek out for yourself an identity that's only the one that you choose, right? I mean, there's certainly that I feel like I run up against that idea. So, I find it heartwarming that Kiara is wrestling with this idea that her grandmother, um, you know, wants her to maintain, or that idea of like I
Mm.
want to maintain this cultural identity. I mean, I do have a patient who was Eastern European, and she had was born with significant facial differences, and had to have a series of operations to reconstruct her face. And she is, by any account at this point in her life, drop dead gorgeous. She just got married a couple months ago. And one of the things that in the series of her operations that she had to reconstruct her jaws because she had a significant jaw asymmetry. When you do those operations, it changes your nose a little bit. And so I had to go and change that. There were some changes and we didn't like the way they looked. So I had to do a rhinoplasty on her. And we specifically, her mother, who, has a very heavy Eastern European accent, was sort of, can you please make sure you maintain that little in the process of it was a functional operation, but it was also there's some aesthetic components to it. And we did, I did not make it I did not take the bump down just a little bit. The woman herself wanted, again, she was 17 or 18. This is a conversation between the family, but this was part of the conversation that we had about how can we preserve her ethnic heritage appearance, but also make some other slight changes that she wanted. And so again, this is that balancing act that we I would say too. I love that this is a debate that people have in practice. Um, this is the back and forth that the surgeon and the patient should have. Um, talking about what are the reasons why you want this, what are your goals with this, what do you think this is going to do for you, that kind of thing, to sort of have this back and forth, um, to make sure that the right decision is being
Mm.
met. Some people don't like that view of the practice of medicine. That some people might say surgeons shouldn't gatekeep. If the patient wants this, then the surgeon should provide the services requested. I mentioned earlier, I think surgeons have a responsibility to not just be proceduralists and do what's being asked of them, but that they have some skin in the game and should engage in the kind of deliberation that you guys would be having around this, are going to have around this case. With the obviously, I wouldn't bring up to the patient, you really have a duty to maintain your Italian heritage, but saying things like, "Tell me more." And asking open-ended questions if she goes into how the ethnic nose is affecting how she views herself.
It is a tough case, isn't it? Because I think one of the other main ethical dilemmas here is the difference between the idea of autonomy and her expressing her, ability to change herself and be the person she wants versus what comes from social pressure. And there's obviously, it's part of a hermeneutic circle. It's sort of part of the creation of the culture is every decision she makes, but she's influenced by the culture. So at what point is it autonomy versus social pressure? And in either direction, whichever she goes, if she decides to get the surgery, she's succumbing, you could argue, to the social norm pressure. But if she goes in the other direction, she's potentially succumbing to her family's pressure, even just internalized family pressure. So yeah, it is a really tough case. But are you somewhat saying that it's like, from a surgical perspective, reasonably easy? And if you determine that the person's like of sound mind, has reasonable expectations, you will just say yes to this. Like, there will not come a point where you turn this person down given those conditions are met.
I think that's right. Yeah.
Yeah.
Yeah. It's usually if a patient has unrealistic expectations, or what they're requesting is just not anatomically possible, then those would
Right.
sort of be hard stops. But if you sort of, but usually the conditions that need to be met are, can I reliably achieve the result the person wants? And, their expectations around the outcome is reasonable.
Mm.
Right? What a loaded word to say. But then I think most plastic surgeons would proceed. Um,
Okay.
but this idea of what is an authentic expression of autonomy is incredibly challenging. One that I think that surgeons don't wrestle with quite enough. In some of my writings, I've talked about, consent is necessary but not sufficient for the ethical discharge of, an operation. Um, uh, that we really, surgeons have to go a little bit further than just getting a signature on a piece of paper saying, oh, this person consents to what they're asking for, and really explore the ramifications of what the outcome could be. Because I think the surgeon has responsibility for that outcome, and how the and if the outcome is not good, the surgeon, again, if you do this thing and you've taken the hump off and Kiara is horribly distressed and hates it, well, then that will be evidence that you did not do your job in exploring, all the different rationale,
Mm.
expectation.
Yeah. Last question for you. Do you think that there should be more focus on teaching like real normative ethics? You should study a bit of Kant and Aristotle in the practice of surgery or in medical school, or do they do that already?
Yeah, they it's not very formal. At Michigan, they get exposed to me, and I teach them that sort of thing. I think when you asked me the question, am I a pluralist? I think part of that is that life is so complicated, and I do have some epistemic humility, that I don't know that I have a good grip on which sort of normative framework is the one that can answer all the questions. And so I think that's why uh, getting a background in as many of these things as you can to inform the dirty work, or, and what I mean by that is that, when you're actually taking care of patients and they're emotional and they're expressing all sorts of desires and expectations, having access to those um, different normative approaches, I think, can only be beneficial. Not to try to rigidly take one and see everything through a Kantian lens, but to sort of say, why is this so jarring to instrumentalize this person in this way? Oh yeah, Kant has something to say about that. In that, and that's the way I think about it. But yeah, absolutely, I think that surgeons should be more engaged in philosophy.
Yeah. Okay. Thank you so much, Dr. Vercler. This has been really fascinating. Thank you for agreeing to do it.
All right, take care.
Ciao for now. Bye.